Hi there. I'm Stacy Nonamaker. I am the clinical director for the Bureau of Supports for Autism and Special Populations in the Office of Developmental Programs. I'm joined today by my colleagues, Angela Fortney, Director of the Bureau of Community Services in the Office of Developmental Programs, and Andrea Layton, who is the Communications and Training Director of the Central Region ASSERT. So you may already be confused with all the bureaus and offices and who the heck is ASSERT. So that's our job today. Today we want to talk a little bit more about what we do in the Office of Developmental Programs, what ASSERT does to support the work that we do in the Office of Developmental Programs, and what that means for you or your loved one or the person that you support in life after school. So we're going to talk again a little bit about who we are, Office of Developmental Programs. We're going to talk about the programs that are available to individuals with autism post-school. We're also going to talk about who administrative entities are, supports coordination organizations, and what they have to do with the programs and the work that the Office of Developmental Programs does. And we're also going to share a lot of resources and information that's developed through our ASSERT partners. Now, again, this is going to be a lot of information. We know that we're sharing. You will have the PowerPoints so that you can reference it later. We've tried to put as much information into the PowerPoint so that when you're ready, when you're thinking about transition to adult programs and post-school life, you will have all this information at your fingertips. Okay, so first let's take a walk down memory lane. So where are we today? Well, we have to start with the MHMR Act of 1966. It set up here in Pennsylvania a county-based system that offered services to people with intellectual disability. And as we learned more about autism, it became clear to us that not everyone with autism had an intellectual disability. So we identified that we had some system gaps here in Pennsylvania. And it really led to a huge advocacy push from the autism community, resulting in the establishment of the Autism Task Force around 2003, 2004. This task force consisted of stakeholders representing multiple constituencies. They were brought together by DHS, and what they did is they really developed a plan. They developed a plan for Pennsylvania, a roadmap, if you will, to understand what sort of system do we need for individuals living with ASD in PA. This statewide autism task force released a rather robust report that identified the challenges here in Pennsylvania, that outlined solutions, and that gave some recommendations to improve the organization, the financing, and delivery of services to individuals living with ASD in the Commonwealth. One of the recommendations was to establish a group of individuals that was focusing specifically on autism here in Pennsylvania. So in 2005, Autism Affairs Office was established. 2 years later, Autism Affairs became the Bureau of Autism Services. And our first effort really was part of the next recommendation in that autism task force. And that was to really be focusing on adult services here in Pennsylvania. Prior to the Bureau of Autism Services genesis, there really weren't adult service systems specifically for autism. Certainly individuals with autism were being supported in ID or intellectual disability programs if they had an ID diagnosis. And certainly individuals were being served in our mental health system here in Pennsylvania, again, if they had a mental health or MH diagnosis. But there was nothing specific at the time for individuals with autism without a mental health diagnosis, without an intellectual disability diagnosis. So really the focus of BAS was on designing, developing, and getting programs for adults approved here in Pennsylvania. So in 2008, the adult autism waiver was approved. We also hosted our first annual Pennsylvania Autism Training Conference. And all this was really important because that training conference really focused on adult needs, adult focus, adult topics, and really helped to bring up a place where there was another gap. A gap where there were no providers focusing specifically on individuals with autism. Certainly, there were providers at that time that were focusing on providing supports to kids with autism, or providing supports to individuals with intellectual disabilities. So we were bringing up, again, a cadre of providers who were willing to step into this new world, the first of its kind in the nation in 2008, and really help us understand what do adults with autism need by way of home and community-based services and supports. Then in 2009, we also had another adult program approved here in Pennsylvania, and that's the ACAP program. It's the Autism Community Adult Program. And what ACAP is, again, first of its kind here in our country, but it really is a managed care program. We'll talk a little bit more about these two programs in just a moment. But as we were bringing up these programs, we were getting a lot of questions about, well, how many people in Pennsylvania have autism? And this was the first time that we endeavored to really understand that. And we published the first Pennsylvania Autism Census with the help of, as you can see in 2010, the ASSERTs. Again, I'll talk a little bit about the ASSERTs in a moment, but the ASSERTs are really a very unique public and private collaboration with the Office of Developmental Programs, an invaluable resource and partnership that we have. And again, one of the very first things that they assisted us in doing was wrapping our arms around how many people in Pennsylvania are living with autism. So we implemented these programs for quite a few years. We got our sea legs. We always like to say that we were changing the wheels on the bus as the bus was moving along, because we were figuring out this landscape of home and community-based services that's been around for a very long time, and trying to determine in a field where there's a paucity of programs and research around what is the best approach to support for individuals, adults with autism. And during that time, we recognized that we really needed to look at some of the other programs that we had in the Office of Developmental Programs and see if we could expand those programs to include individuals with autism. Historically, the programs in ODP have been specific for individuals with ID or intellectual disabilities. So in 2017, ODP expanded the programs that were historically for individuals with intellectual disabilities to include individuals with autism without ID. So that's a big moment here in Pennsylvania, because now for adults who have autism without an intellectual disability, what is available, it has expanded greatly. Then in 2018, we were asked to include what's called the Special Populations Unit into the Bureau of Autism Services. The Special Populations Unit was designed to oversee deaf and hard of hearing litigation here in Pennsylvania, and really expanded to think more about all things communication in Pennsylvania. And, communication spans across all our programs, all our conversations around services and supports, and really has been a focus in our Special Populations Unit here at BAS. So because we were Bureau of Autism Services, we had to change our name to capture the Special Pops Unit. And so in 2019, we changed our name to the Bureau of Supports for Autism and Special Populations. And by way of a shameless plug, in October 2021, we sent out a save the date. We're going to have our 14th annual PATSI. So again, going all the way back to 2008, when we designed our first Pennsylvania Autism Training Conference to bring up providers to support the programs that were approved here in Pennsylvania. 14 years going strong, still focusing on all things autism and with a primary focus on adults with autism. So hopefully that gives you a little bit of an idea from where we've come from to where we're heading. Let's just shift a little bit here and talk about specifically in Pennsylvania, what's available to individuals with autism. So some of you may be along the life trajectory where you're ready for transitioning out of education, or you're still in the throes of education and thinking about that, not yet thinking about what happens after the educational entitlement for you or your loved one. So if you're at that stage, you know about, probably know about early intervention services that are provided by our colleagues in the Office of Child Development and Early Learning. Those services stop around the age of 5. You're probably very familiar with the Pennsylvania Department of Education and the special education services, as well as EPSDT, and the behavioral health services that are provided through our colleagues at the Office of Mental Health and Substance Abuse. Where we're going to structure and focus the rest of our session today is really in that box, the Office of Developmental Programs, and the services and waivers that we are able to provide individuals with autism, and what that looks like. Specifically, who are the players in that process, as well as how do you get started in determining whether or not you're eligible for any of these services and programs. So these are our, we like to call them our Where's Waldo slides. So in the beginning, when I was introducing myself and my colleagues, you know, there's a lot of bureaus and offices, and you know, really we created these slides to help the autism community figure out where we are and what we have purview over. We don't, in the Office of Developmental Programs, have purview over everything that's related to autism. So we'll just give you a brief overview of where we fit into the bigger scheme of things, point out some of the things that we feel are really important. And we'll start with the Pennsylvania Autism Insurance Act, which is Act 62. You see that lives in insurance. For those of you that don't know, Act 62 is a statewide insurance mandate. It's specific to services provided to children and adolescents with ASD. So in order to provide services under Act 62, primarily applied behavior analysis, Act 62 introduced what's known as the Behavior Specialist License. And that lives in the state. You'll see that in your upper left-hand box there. And that is, while we've had input, while we've had purview, while we at ODP provide training for people who are seeking their licensure, really the licensure lives with the state. And that's all important to figure out because, again, there we are, Office of Developmental Programs and Human Services in the governor's office. While we work closely with all our colleagues in the other departments, it's just important to point out that we don't have total purview over everything autism. So if we get a little more granular and look closer at the Department of Human Services that was on the previous slide, you'll see that there are a lot of other offices that, once again, we're coordinating with that are also serving and providing supports to individuals with autism across the lifespan. So there's the early intervention services that I mentioned. There's the BHRS, now IBHS services, that I mentioned. And we're there. We're in the Office of Developmental Programs there at the bottom. And I mentioned before that the Bureau of Supports for Autism and Special Populations lives in the Office of Developmental Programs, along with another bureau that oversees programs and services for individuals with autism. And that's the Bureau of Community Supports. You'll see that across the two bureaus, there are 5 programs that are available to individuals with autism once eligibility certainly is determined. So we're going to talk a little bit more about those. I'll give an overview of those programs. So in the Office of Developmental Programs, there's 3 historically intellectual disability programs that now are considered, we call it IDA. We love our acronyms, right? So it's Intellectual Disability Autism Waivers, serving individuals with ID and or autism, ages birth through adulthood. And then we have the 2 programs that I mentioned in our timeline that are specific for individuals with adults, serving individuals age 21 or older, with or without ID. So first, for the BCS, or the Bureau of Community Supports Programs, there are 3 waivers. They're home and community-based waivers. There's a person-family directed supports waiver. It's our PFDS waiver. Again, for this waiver, you need a diagnosis of ID, autism, or another developmental disability. Excuse me. There's no age limit. You do have to meet functional and financial criteria. And there is a cap at an individual cost limit of $33,000 per fiscal year. Under BCS, there's also the consolidated waiver, same diagnostic criteria as PFDS, and no age limit like PFDS. Like PFDS, you need to meet functional and financial eligibility, and no individual cost limit for consolidated. And finally, one of the newer waivers in BCS is the community living waiver. Again, same diagnostic criteria, age limit. Actually, you have to meet functional and financial eligibility for community living, and there is a limit per year of $70,000. So services may differ across each of these waivers. The person-family directed support waiver is exactly as it says. Individuals have access and are available, or have the ability to spend the funds that they're given each year across these services that you see right now. But even though the waivers do have some differences, there are many similarities across the waivers in terms of what services are offered through these programs, like supports coordination or case management. Certainly a focus of ODP is to increase engagement in employment, and behavioral supports where needed, as well as any other habilitative supports that are needed that can focus on skill building, working towards independence or interdependence. Again, for consolidated waiver, you'll see a lot of the same services that you see in PFDS. For consolidated, you'll see residential services, both licensed and unlicensed reshab. So think here things like family living, group homes, etc., and supported living. And then finally, excuse me, community living waiver, a lot like PFDS. Again, focus on employment and any of those other necessary supports that people need to be showing up the way that they want to show up, whether it's from working on some behavioral challenges or working on skill building or need for therapy, or perhaps something like shift nursing. So now we're going to pivot a little bit, and we're going to talk about those programs, those 2 programs that I mentioned that are offered through BSASP, and they're the Adult Autism Waiver and the ACAP waiver. I just want to take a second to just point out the difference between the 2. So the adult autism waiver is much like the BCS waivers that I just described. They are designed to provide long-term services and supports for community living. Again, the adult autism waiver was designed for individuals age 21 and over, available statewide, just like the other BCS waivers. And really focusing on, like the other BCS waivers, a choice, participant choice in terms of services and providers, and ultimately based upon need, what the individual needs. The biggest difference is the adult community autism program is not a waiver like the other waivers I've described thus far. It's really a managed care program. It's only available right now in a limited number of counties in Pennsylvania and central counties in Pennsylvania. And the services are provided by one primary provider. It's Keystone Autism Services. And what they have done as a managed care organization is they have created a network of providers, including primary care physicians and other physical health providers, so that they can be providing the individuals physical, behavioral, and community services. And really looking at making this a coordinated care approach. So integrating all of the physical and behavioral health services, making this seamless, making it a responsive service model, so that individuals get what they need when they need it. So here's just an idea of what is provided in the adult community autism program. And what ACAP will pay for by way of physical health services and home and community-based services. Unlike some of the other waivers here in Pennsylvania, there's no maximum amount of funds or services that an individual can get in ACAP. However, I will strongly emphasize that, once again, what someone receives in this program is based primarily upon what they need. So there are assessments that the provider will do, and the behavioral health specialists will do some assessments like functional behavioral assessment and give input and recommendations to the services that an individual needs. And not just which services, but how much of each service that the individual may need. I want to point out that in ACAP, one of the strong components in this program is looking at family support. So the ACAP provider is able to provide therapy to families. So oftentimes what we have seen since the inception of these adult autism programs is that families have been doing the best that they can since their individual had graduated from school and perhaps was no longer receiving services or was receiving minimal services or perhaps even inappropriate services or services that weren't meeting their needs. So we've seen a lot of families who really have been struggling on a couple fronts. One being that concept of letting go, because for so many years, families have been providing the support where there were none. And the other is, just really helping families understand how they can shift their role in supporting their loved one now that their loved one has some services and supports. So we think that is a very important and helpful service in the ACAP program. And that's also included in the adult autism waiver. So the adult autism waiver, again, is statewide. And as I mentioned before, that it's a lot like the other waivers. It's similar to ACAP in that we're supporting individuals age 21 and over. Similar to ACAP in that the focus really is on individuals becoming as independent as possible, becoming contributing members of their society. Similar to ACAP in that we're focusing on how can we support families through family support, through home modification. And the thing that I want to point out here with the adult autism waiver is we're really looking at, under specialized skill development, how can what we know about autism is we know that there's science out there to work on skills, to teach individuals skills to be more independent. And so the adult autism waiver focuses on systematic skill building, community support, working on taking that science that we know and love and employing it in a very traditional home and community based model. Um, so again, the adult autism waiver does not have a maximum amount that the individual can get, but like ACAP, we do look at what does the individual need in terms of looking at assessments, looking at the person's desire of where they want to live, work, and play, and what services can help them meet those ultimate life goals. So the difference with the adult autism waiver and ACAP that again are administered through the Bureau of Supports for Autism and Special Populations, the difference between those two programs and the PFDS, community living and consolidated programs is that BSASP oversees or is the administrative entity of these programs. So we are working closely with providers who are providing these, who are enrolled to provide these services. We're working to ensure that they are qualified providers. We are working with participants and families to ensure that they're receiving the services and supports that they need in the way that they are designed and written into their plans, which Angela will talk about in a little bit. So that is different. And again, the BCS programs are administered, going back to that MHMR Act that I mentioned, are administered through the counties. And Angela will also talk about that in just a moment as well. So, it's a short amount of time between 2008 and 2021 that we're bringing up these programs. We've been able to renew these programs along the way with the feds. So we're able to have some federal dollars, some state dollars that support these programs. We've been changing the programs as we learn more about what people need. For example, in the adult autism waiver, at its inception, we did not have systematic skill building. We assumed that other services would be working specifically on systematic skill building. What we learned over the years is, although very important to be focusing systematically on building skills to become more independent, we learned that other services weren't doing it as we assumed and as we expected, and it's in the waiver's original design. So when we renewed the waiver in 2016, we added that service. So that's a really cool thing about waivers. Over time, as we're renewing them, we're able to change them as we learn more, as new technology becomes available to us, and as we grow based upon what participants and families need here in Pennsylvania, so that we can be more supportive of them over time. So as BSASP and ODP are, working at keeping the bus moving in terms of all of these programs and all individuals that are in these programs and beyond, again, we work with other offices very closely who are supporting individuals with autism. So while we're busy doing all that, we identified this early on, that we needed partners who could also be looking at community-wide, what in terms of our community, Pennsylvanians living with autism, caregivers and families of autistic Pennsylvanians, what exactly are they needing while we're bringing up these programs? And that's where, as a state, we have been fortunate to have this partnership with ASSERT. ASSERT is the Autism Services, Education, Resources, and Training Collaborative. It is a statewide initiative, again, a unique initiative here in ODP. And it's a partnership with universities and hospitals and medical centers. We have 3 regional asserts that work very closely together. The Eastern region is housed in Drexel University. The Central region is housed at Penn State Hershey. And the Western region is housed in UPMC out in Pittsburgh. Really, ASSERT has been a key component of supporting ODP's strategies for supporting individuals with autism and their families throughout Pennsylvania, really focusing on providing supports across the lifespan and providing supports to individuals who may not even be in a program. So just a few ways before I turn it over to Angela to talk more specifically about the programs that I'm sure you're all interested in, but just a few ways that ASSERT supports ODP. Really, we boil it down to 5 ways. We're constantly looking at ASSERT support in terms of data. As I said early on, we had people saying, you're designing these programs, but do we know how many people with autism live in Pennsylvania? So ASSERT has supported us to do 2 iterations of the Pennsylvania Autism Census. So Andrea will probably talk a little bit about that later. ASSERT helps us conduct focus groups within our programs to help us learn about participant experiences. And also, ASSERT supports us to do a scope of Pennsylvania on what are people needing, both by way of autistic individuals, families, supporters. What do they need? What do they need by way of services? What do they need by way of training and support? And that really helps to shape ODP's strategy around supporting individuals with autism. ASSERT also provides clinical support. So they've conducted social skills groups, they've provided assessment clinics that are sorely needed across the state. They have designed a psych rehab model for individuals with autism that is modeled after a mental health psych rehab program. They have provided supports to our programs in ODP to help us look at risk a little differently, and we've designed a tool called the Periodic Risk Evaluation. ASSERT also provides education and resources through things like infographics and policy briefs and service guidance documents. And Andrea will talk probably a little bit more about the ASSERT Resource Center, which is a very important part of our ability to put out for the community a resource that they can call to ask, where are these sorts of things in Pennsylvania? What do I do if my loved one is graduating this year, et cetera? And last 2 things that ASSERT does to support ODP is training. A lot of training is happening through our ASSERT partners. Between ASSERT and BSASP, we have a huge training focus. We're constantly looking at building capacity around justice professionals understanding autism, first responders understanding autism, general ASD 101. Anybody out there that's looking for training on ASD 101, focusing across the lifespan, specifically on adults, we are providing that as well. And providing some continuing education credits, which has really been well received, especially around psychopharmacology and medical focus. And then we're constantly looking at ASSERT support for designing policy, developing policy for the programs. So helping us develop the ACAP agreement, which is our ongoing agreement with our ACAP provider, as well as helping us translate policy that sometimes can be so convoluted and difficult, even for those of us in the system, but helping us translate that for individuals and their families and their supports. So just an introduction to what Angela and Andrea are going to dive deeper into. I'm going to turn it over to Angela so she can talk a bit more specifically about ODP, who the AEs or administrative entities are, who SCOs or supports coordination organizations are, and how you get started with determining eligibility for autism services throughout ODP.
Hi, my name is Angela Fortney. I am the Division Director for Program Administration with the Office of Developmental Programs within the Bureau of Community Supports. As Stacy had stated, I'm going to go into a little bit more information related to what a county is, what an administrative entity is, as well as what an SCO or an SC is and what they do, what information a person might need if they're seeking services within ODP, and what's available. So as Stacy stated, Office of Developmental Programs provides a wide variety of supports and services and resources to individuals who have intellectual disability, autism, and children who are 8 years and younger who have a developmental disability. We do this through direct administration with our county programs, which I'll talk about a little later. Most of our services are funded through the federal government, along with some supported funding through state and county funds. But we are focused on supports and services within the community. ODP's mission and focus, I just thought it would be helpful for us to talk about this a little bit so it kind of puts some context to our conversations today. The mission of the Office of Developmental Programs, or ODP, is to support Pennsylvanians with developmental disabilities to achieve greater independence, choice, and opportunity in their lives. Our priorities and initiatives are guided by the recommendations in our everyday lives, values, into actions. And that document was developed with our stakeholders, both individuals, advocates, and their families, identifying what the priorities that they have that they would want the office to promote, and what the families also are prioritizing. So when we develop services or planning, we always are guided by those guiding rules within the everyday lives, values, into actions. As Stacy had stated, we provide community services. It goes the gamut from supports coordination to in-home supports, residential habilitation. We provide community participation supports, which include supported employment, job coaching, and vocational services. All of these supports are provided either through base funding, which is county funds, or our federal waivers, which is both federal and state dollars. And we'll talk a little bit more about how a waiver is accessed. All of these services and supports are provided by providers who are within our community, who are qualified by our administrative entities, and the administrative entities also monitor those services and supports that those providers deliver. And we'll talk a little bit more about that. So here you can see kind of the context of the service system and support system within the Office of Developmental Programs. ODP has a hub in Harrisburg. We call that our central office, and we work directly with our regional offices, which are located in Pittsburgh, Scranton, Philadelphia, and Harrisburg. Those regional offices work directly with those counties that are within those regional geographic limits, and they work collaboratively on assisting and providing technical assistance to those counties, as well as provide information and training to those AEs as they are administering our ODP programs. We also have what we call our HICUs, which is Healthcare Quality Units. And I'll give you a little bit more information about what they do. We also have our providers in our service system who directly provide those services and supports that are identified on an individual's support plan. We have support coordination organizations that employ the support coordinators that are your key to locating and identifying those service providers that can meet those service needs that are identified on support plans. And our advocacy organizations, which we work closely with to identify gaps or issues in the system to ensure that we're providing the services and supports needed within any part of the Pennsylvania counties. So administrative entities and counties are basically the same entity. And it gets a little confusing. When we talk about counties, we're talking about the local entity, which is also the administrative entity who administers our waiver programs. And I'll talk a little bit more about that. Stacy did touch on that in her presentation about what those waivers are, but these county entities are the responsible parties for ensuring that locally those waivers are operated in the way that we've written them and have approved through the federal government. So a county, each county in the Commonwealth is represented by a local office, and they're called the MHID or MHDD office, which is mental health, intellectual disabilities, or mental health, developmental disabilities. We have counties and county joinders. So that gets a little confusing. You may live in a county that's joined with another county, and they work together to administer the programs through mental health and developmental disabilities. Pennsylvania has 67 counties, but through ODP and through the MHDD, we have 48 county joinders. When a county joins with another county, that just means that they're working together. They have an agreement to share those responsibilities of administering those programs. And they do that primarily with one county being the lead. These counties and administrative entities serve as the first point of contact for any person who is seeking supports and services. They would be the first place a person should go to explore what's available and whether or not that person who's seeking services may be eligible for the services that we provide through either our county-based dollars or through the waivers. Any person, and we'll talk about this with regard to the support coordination organization, any person who's been determined eligible will be offered a supports coordinator, and we'll talk about their role. So when someone who believes that they may benefit from the supports and services that ODP provides and believes that they would meet the eligibility, they would contact their local office, and I'll provide the link to the contacts for each of the local offices at the end of the presentation. One of the things that the AE will need, the administrative entity will need, is information on your diagnosis, information on the abilities and skills that you have or the person has in order to determine whether or not you meet the eligibility requirements within our county system or within our federal waivers. So who is eligible for supports? As Stacy had stated, in 2017, we had expanded the waivers, the community living waiver, the PFDS waiver, and consolidated waiver to include individuals with autism within those waivers. Both individuals with intellectual disability or autism, they must have evidence of the disability that has presented prior to their age of 22. That information needs to be provided to the county in order for them to identify whether or not they meet the eligibility within the waiver. Anyone who is identified for eligibility must meet the same criteria. So across the state, these are statewide waivers and statewide programs. Everyone would need to meet the same criteria across the waivers. And as I said, for those that qualify and have been determined to meet eligibility, they would be offered to receive supports coordination. And for that, we have no waiting list. But for the 3 waivers, the IDA waivers, consolidated community living and person family directed waivers, we do have a waiting list, and I'll talk about that a little later. So the information needed in the psychological is information on the diagnosis. So we would need to have evidence that supports the diagnosis of an intellectual disability or autism. We would need a completed signed psychological per our waiver, standardized adaptive assessment, and within our policies or our bulletins, we accept a Vineland or an ABOS. The county would also need a birth certificate, your social security card, and if the person's enrolled, a medical assistance card, but that's not necessary upon determination of eligibility or to be put on the waiting list. That is just necessary for enrollment into a waiver. So when the individual or their family provides this information to the county would take that information and they would evaluate it to ensure that that person meets our programmatic eligibility. If the person doesn't have medical assistance, the county would be responsible for assisting that person in understanding how to apply for medical assistance. Not only will that assist the person while they're waiting for a waiver, it will also help them be eligible upon a waiver enrollment. So we also have the administrative entities or counties complete PUNS, and a PUNS is a prioritization of urgency of needs for services process. And that process establishes where the person is on the waiting list, on the ODP waiting list. And if applicable, the county would also identify any other sources or resources that the person may be eligible for so that they could get services from other entities if they are put on a waiting list for services with ODP. So after all of that information is gathered by the county would complete an intake. And at that time, the county is going to ask for additional information beyond what's contained in the information that you've already provided. That would include a social history, that would ask developmental information, any other information on medical history, the individual's strengths and abilities, and any important relationships for the person, and any other related family history. This is important information to ensure that the county or administrative entity has the appropriate information to complete all documents, including the first individual supports plan that the supports coordinator would work with the individual's team to complete. Every person who's enrolled that's receiving a service, even if it supports coordination, will have an individual support plan in our web-based system. And that web-based system is called HCSIS. ISPs are important because they document relevant information about the individual so that any service provider or any supports coordinator will have that information to address all their services and how they would deliver those services to the person. The ISP is a person-centered document, so it's important that the person is the focus and the center of that plan And that plan is shared with all providers that the individual and their team has chosen to provide services to them. So another role for the county or administrative entity is they provide the qualifications, or they qualify providers. And this is a statewide process. It's something that every county does, but they won't do it for the same provider. So that provider may be a statewide provider, but they would have one AE that would qualify them. And the qualifications are all contained in our IDA waivers for each service. So each service contains specific qualifications that that provider must meet in order to qualify and then subsequently enroll with ODP to deliver that service. Qualifications will span the gamut of CPR certification, background checks, specific training, education dependent on the service. And they're all contained and available in our waivers on the DHS website. Providers must demonstrate that they're qualified on a regular basis. And so counties will be doing that on a regular basis to ensure qualification, so that that provider, any individual who is receiving services from that provider, can be assured that they will continue to meet the criteria that has been established in the approved waivers. Risk management is another important role for the administrative entity. However, this is a responsibility across the service system. So although the AE holds a very important role related to risk management, so does the support coordinator and the provider. What is different about the AE's role is that they not only follow our risk management guidelines, but they also provide information, guidance, support, and they oversee the provider's implementation of risk management. The AE serves as a liaison between the Office of Developmental Programs and the provider's risk managers in order to ensure that the AE has the most up-to-date information related to risk management and risk management mitigation, so that they can provide that information to those providers in order to implement that when delivering services to an individual. We want to make sure that across the state that AEs and providers and SCs have the most up-to-date information related to risk management. So we share this information in meetings and communications around how risk factors are identified, how risk factors are mitigated, and all of that is part of an individual's plan in order to mitigate any risks that might be identified. AEs will also coordinate those meetings with the individuals and with the providers to ensure that they have the most up-to-date systems, to ensure that there's improvement activities happening when there is risk identified. There also is individual incidents that are a responsibility of the entire service system. So when an incident that is defined in our incident management bulletin and in the ODP regulations happens, the provider or SC, the support coordinator, would be responsible to report that incident, and the AE would be responsible to review all incidents and approve or disapprove the actions within that incident. The administrative entity also holds a responsibility to investigate certain incidents to ensure that there was corrective action that was appropriate, that all identified triggers were resolved, and any individual who is a perpetrator or a target has been removed from the situation to ensure that the incident does not reoccur. So we're going to move on to support coordination organizations and their roles and responsibilities. Within a support coordination organization, you have supervisors and SEO management that are part of the team within the support coordination organization. The management, typically you would have an SEO director, and then below that you would have an SE supervisor. And you'll see here that when an SC is developing a plan with an individual in their team, the supervisor is responsible to ensure that they review that plan, they provide any guidance and support to the SC to resolve any issues or identify services that might meet a need that the team may not have considered. The SEO management would be responsible for submitting any plans to the administrative entity for approval of the content of the plan and authorization of the identified services. So the AE would be responsible to ensure that for each service that's been identified, there's an associated need of the person, and that corresponds with that service. So they're assuring that the service will meet the need. And in all of this, they're all responsible to ensure that the ODP policies and procedures and our protocols have been followed. So a support coordinator's role is similar to a caseworker, and that support coordinator is kind of the keystone to making sure that the person and their team has the information necessary to make informed decisions on enrollment into a waiver, a choice of the service to meet the need, choice of willing provider. All of those things in SC is really the key in providing the necessary information for the team and the person to make an informed decision. So we call these primary functions locate, coordinate, and monitor, but they really are weighted terms because behind each of them, there's a lot of work that the support coordinator needs to do in order to perform them. What they need to know is what's going on with each individual they support, where is the person and where are the services that are local to that person that might meet those needs. They must provide information on the service plan process so that the individual understands how the planning process will occur. They also, before they're submitting plans to the support or to the administrative entity, they should ensure that the services identified will meet the person's needs. The support coordinator also has a responsibility for monitoring, and they do this by calling or going and visiting the person to ensure that their health and welfare is not at risk, to ensure that the supports and services that they're receiving are meeting the needs, and that there's nothing else that the person needs or that they didn't have any change in need during the period of time between monitorings. The support coordinator also, for anyone who at the time of an incident doesn't have a provider delivering the service, the support coordinator would be responsible for reporting those incidents and ensuring that the corrective action occurs to protect the person upon that report. They would be notifying the administrative entity, so the administrative entity could assign a certified investigator to conduct an investigation, and they would utilize our enterprise incident management system to report that incident. All of this is done within the locate, coordinate, and monitoring roles that are described in our targeted support management state plan, as well as in our approved waivers. So some other things that the support coordinator will do is they'll talk to you and help you understand what supports and services might be helpful to meet the needs. And this really is to be done in a person-centered way. So identifying, from the person's perspective, what they want, what they need, what would be important to them, and as well as talking to the team to ensure that they identify what would be important for that person. So all of that is done through that planning process. Not all of the supports that the person may receive are paid for. We have a lot of individuals who have enrolled in just supports coordination, and they receive supports from their family and friends and community members. So when developing plans, all of those resources should be considered to ensure that the person is supported within their community and they are a part of their community. The other piece is making sure that there's a connection with the agencies within the community that could support a person. So making sure that all of those connections are made and that's documented so that when another provider who's been chosen to support you might be identified, that they have all of that information contained in one place to begin the planning process and development of the support plan that the provider will be implementing. So I'm going to go over some of the eligibility information specific to autism within the IDA waivers. The waivers do support more than individuals with autism. However, we're just going to focus on autism today for this presentation. As we talked about, and I think Stacy addressed in her beginning slides, that we do offer supports to individuals with intellectual disability and autism, as well as children 8 years and younger with a developmental disability. So within the waivers, we have 4 criteria that must be met in order for someone who has a diagnosis of autism spectrum disorder to be considered as eligible for waiver enrollment. And the 4 are listed here. The first one being that the person must have an autism diagnosis, and that diagnosis must be based on diagnostic tool or tools. Those tools can be clinical interviews or observations, self-reports, previous reports, or records that were identified and provided to the administrative entity, or any formal assessments. The second piece is having substantial adaptive skill deficits in 3 or more areas of major life activity. And that would be identified by using the standardized adaptive functioning test or standardized adaptive assessment. As we talked about earlier, that would be either a Vineland or an ABOS. The third is the disability must have occurred prior to the age of 22. There must be evidence that it happened prior to the age of 22. If someone is being assessed after the age of 22, they can still enroll in our programs after the age of 22, but we just have to have some evidence that the disability occurred prior to the age of 22. And the fourth is a federal requirement that the person must be recommended for an ICF level of care based on a medical evaluation. So that means that within the process, we would need to have a medical professional as defined in our waivers to say that that person needs that level of care, an intermediate care facility level of care. Typically, when they meet the first 3 criteria, the person would also meet that 4th criteria. So there's 2 major pools of supports and services within the ODP service system. The first is the targeted support management. Targeted support management is similar to support coordination as it's delivered in the waivers, but it's what happens when a person comes to an AE is determined eligible and they're waiting for additional services. They will be receiving targeted support management services if they have MA already. That service will also provide the person with the locate, coordinate, and monitoring services that support coordinators complete. They can provide those services and provide interaction as often as that person needs it. It doesn't have to be, once or twice a year. It can be more often than that, as determined by that person's team. But once a person is determined eligible and has MA, they can receive that targeted support management service. The second pool is the waiver enrollment, and that would provide you or the person with funding for services. And Stacy went through in detail the services that are available through the IDA waivers. All of those services that are available can be identified to meet a need on a person's plan. So the support coordinator who's assigned through the waiver would be able to talk through all of those services and what is available and how to make those choices around services to meet that assessed need. One of the other things that we talked about is the prioritization of urgency of need for services, or otherwise known as PUNS. PUNS has been around for a very long time. At the core, it's always fulfilled the same function to identify with some objectivity how urgency somebody needs services. It also identifies what services and supports the person may be currently receiving, whether it's through a paid service or an unpaid service or through another program. So this tool is really to ensure that ODP and the AE and the SC have the most up-to-date information around what services the person needs based on this evaluation tool. The support coordinator would work with the individual and their family to complete the PUNS. This document and the tool would be completed at least once a year or more often as the person's needs change. It would provide information on, where the person is currently receiving services or where the person is, and evaluate based on what is happening in that person's life now to provide what category of need that person might fall into. Once a person's in a waiver, there may be some unmet needs. So that this form will also identify what services the person may need to meet those unmet needs. What's important about the PUNS is that it will put individuals in 3 buckets. The emergency bucket, critical, or planning. And you can see that each of them have different definitions. So when a person is identified as having an emergency need, that means that they have a need now. There might have been a death in the family, a family crisis, a serious illness of a caregiver, or the caregiver is no longer able to provide care, and there's no other person to care for the person. We also talk about the critical category. This category is any services that are anticipated within 2 years, within the next 2 years. They could be behavioral support needs, medical concerns, or conditions that may warrant additional services. There may have been also a change in a caregiver, but it hasn't raised to the emergency category yet because there might have been another person available to provide those supports. We also have a planning category. And so this is a category where it's helpful to identify services that might be needed in the next 2 to 5 years. that individual might have an aging caregiver who wants to continue to provide the services now, but may need additional supports and services in the next couple years. So when the form is filled out, this helps the county identify who within the county or the administrative entity would need services immediately in order to identify a waiver capacity or enrollment for a person in a waiver. Excuse me. So we've already talked about that the form would be completed at least annually. We encourage individuals to, when they're speaking to their support coordinators, to ensure that they tell them when they have needs that have changed, so that the SC can provide that current information on their PUNs to ensure that they're in the category that is most appropriate to identify their needs for service. The emergency category is important because the majority of individuals who are enrolled in a waiver must have an emergency need. There are other categories of enrollment that allow for critical and planning, but the primary category of enrollment that person would have to have an emergency need on PUNs in order to be enrolled in a waiver. So we talked a little bit about the individual support plan. I'm going to go into a little bit more detail on what it is and why it's important. So as we talked about, the ISP is developed through a person-centered team process. This would be where the support coordinator would pull together your team or the person's team, individuals who are important to that person, family members that the individual wants to have there, any current service providers that are providing supports and services to the person, in order to have a discussion about the individual's plan, whether it's current, what needs to be updated, any services that need to be changed to meet different needs. All of that is part of that planning process. It is intended to ensure that it's flexible so that when a change occurs, that change can happen within the plan, so that all the service providers who are providing supports to an individual has the most up-to-date information. The ISP would contain all of the information around what supports are happening now, including any natural supports or unpaid supports. It is an outcome-driven record, which means that we base all of the services on a plan to ensure that whatever outcomes the individual and the team have identified, that's what the services are planned, and the goals that are developed are being driven to. And the document itself is recorded in our HCSIS system so that it's web-based and accessible to the AE, the SC, as well as the providers who are supporting the person. The ISP is standardized, so for everyone who's using it across the state, it is something that contains the same sections and information for all individuals who are enrolled with the Office of Developmental Programs. Our plan follows our everyday lives, values into actions, guiding actions, as well as person-centered planning principles. Within the document, it identifies all the individual's priorities, their likes, their dislikes. It ensures that they're focused on all of the person's abilities and the needs for support. We also include medical information, health and safety, and identified risks and mitigations to those risks. And of course, within the plan, all of it should be meaningful to the person who the plan is about, so that that is what's driving all of what is provided to the person based on what they want and what they need. So we talked a lot in the beginning about the waivers. Home and community-based waivers are what Stacy had talked about earlier, and I mentioned a few times. The consolidated, community living, person family directed, and the adult autism are all waivers that ODP operates. So waivers are interesting, and some history on them. For years in our past, institutions were the primary source of supports and services for individuals with developmental disabilities, as well as individuals who have acute mental illness or epilepsy or some other conditions. And in decades past, people lived in those institutions until they passed away. No one necessarily left institutions until it led to overcrowding, and there was little to no increase in funding. And as this was going on, there was a greater awareness and acknowledgement of individuals who were living in those institutions and their rights and feelings and their rights to live in a community. These two elements, as well as some of the news articles and news stories that you might have heard, excuse me, related to some of the institutions within Pennsylvania and other states, led the government to create ways to fund services within the community rather than in institutions. And this led to waivers. These were waivers of the federal regulations that guide and provide rules for those institutions. So it waived those regulations to allow those public dollars to be funded and used for individuals to remain in their community and be part of their community. The consolidated waiver was one of those first waivers, and that was consolidating those geographical waivers that were the first waivers within the state. And we consolidated them to make it easier for us to provide oversight and more consistency across the state. The person family directed waiver was the second waiver added for an option for people who were still living at home with their families or independent in their own home. Subsequent to that, the adult autism waiver was created to provide specific services for adults who have autism. And then most recently, we've added a mid-level waiver, which is the community living waiver. Some of the services may differ between waivers, and Stacy went through that at the beginning. It may provide limits to services with specific eligibility. And we do have assurances in each waiver that the federal government requires us to assure to make sure that we're following all the rules, that we have service provisions and level of care that are consistent and followed across the state. So all of that is consistent across each waiver, those waiver assurances. As we said, we operate 4 waivers. One person can only be in one waiver at a time. So you can't have a person who's in the adult autism waiver and in the PFDS waiver at the same time. And when we talked about the ISP, we talked about when a need is identified, those services must meet those assessed needs. So when they're planning for any services and supports, there must be needs that have been assessed to identify that service will specifically meet or exceed that need that has been identified in any assessment or in the ISP. And I think Stacy went over the caps and the differences in the waivers as far as how they operate. and the funding caps and the two waivers that serve IDA populations. So here you'll see some of the services that are identified. Stacy went through the gamut of the services that are available. We do encourage community-based services and supports. We utilize those assessments and services to identify the supports needed to ensure that a person's, retaining skills or learning skills to remain independent or gain more independence in a least restrictive environment and least restrictive services. So those services that are available there, depending on the person, you might find that life sharing might be most appropriate for you. And there's a definition within our waiver on what that life sharing service is and what it will provide. And we talked about earlier that providers of that life sharing service must meet those qualifications that we've designed within that waiver to continue to deliver that service. So kind of shifting gears a little bit, I know we talked earlier in our circles of support and the system about healthcare quality units. Healthcare quality units are entities that work to support and improve the health information and knowledge across the state in our community system. They are providing overall information to ensure the health status of information receiving services is assured. They work to support and improve the community system by building capacity and competency through trainings and direct technical assistance to providers to meet physical and behavioral needs of individuals who live in Pennsylvania within the IDA system. Right now, we have 8 HICUs across the state. If you're interested in learning more, there's a link there that provides you with each of the healthcare quality units and a link to their direct website. So I'm going to end a bit about, health and welfare. We talked a little bit about risk management, but an overarching responsibility across the service system is to ensure a person's health and welfare. This is regardless of whether a person's enrolled in a waiver or not. It is ultimately ODP's responsibility, the AE, the SC, and if the person's receiving services, the provider's responsibility to ensure health and welfare. We do that by ensuring that there's one place to report any incidents. So we utilize the enterprise incident management across the board to enter any incidents that might occur. We have regulations that identify what alleged incidents should be reported. And it goes from medications that are missed to hospitalizations to suspected abuse or neglect. This way, we have a single entry point and review point for all of those incidents, and we're able to see them across the person's service system. We also are able to use this in a way that will pull data out and identify trends and issues that we can address through systems management, change in policy, change in approaches to ensure that we're doing the best to ensure that people can live an everyday life without abuse and without neglect. So just in review, once a person's enrolled with ODP, most likely they will be enrolled and receiving services for their lifespan. The purpose of those supports and services is to ensure that the person is most independent as possible with those services and supports, to ensure that they're maintaining or learning new skills. We want to make sure that all of the least restrictive service options are being identified. we build into the service definition, independence and choice and control, so that the individual has that choice and control of what they are doing in their life. And the ultimate goal for ODP is for each individual to attain an everyday life. And if they're not supported in achieving this, then we need to do better and we need to change how we're doing things. But the ultimate goal is to promote the everyday lives as defined in our document, Everyday Lives, Values into Action, so that we are there to support the person to have the life that they wish to have. And here are some additional resources. I know that Stacy had provided some in the slides that she presented, but these, I think I have a duplication of the CERT, but these are some of the additional resources that you can use to find out more information. There is a link, the third link there is the direct link to all of the PA counties and administrative entities. So you can find the local county where you live, the Mental Health and Developmental Disabilities Office, to provide you with additional information. And with that, I will be handing it over to Andrea Layton.
Thanks, Angela, for all of that wonderful information, and Stacy for the intro. So I am going to get into a little bit more about ASSERT, who we are, what we do. As Stacy said, all of the things that we do to support ODP and the work that they do, and how that interacts, and all of those good things that we do. And hopefully be providing you guys with some really great information and resources, or ways and where to go to get more information to kind of help with all of this process of, connecting with counties, waiver services, plus just additional resources that we work on. It can all be very, very overwhelming, and a big part of ASSERT and who we are and what we do is aimed at trying to make it a little bit easier and a little bit less overwhelming for individuals and families who are trying to navigate these systems that are out there. So let's get started with who we are. All right, so Stacy shared this graphic a little bit earlier, way back at the beginning of the presentation. This is kind of our ASSERT map, just to give you an overview of who covers what. Again, ASSERT stands for the Autism Services Education, Resources, and Training Collaborative. And really the key there is that we are a collaborative. We are a collaboration between 3 universities across the state. So while we do kind of split things into regions, we work together. We work together very, very closely on most of the trainings and the information and the things that we do. But this is just a brief overview of kind of how we split up the state into the different regions. And as a reminder, in the Eastern region, it is out of Drexel University. Central region, which is where I am located, we are out of Penn State Hershey and the College of Medicine. And the Western region is out of UPMC, and they're affiliated with Western Psych out there. All right, so what do we do? So we have a really long name, said the acronym multiple times now, but really this kind of gets at what it is that we do, the overall goal of ASSERT, why we were created all those many, many years ago, and what we aim to do now and moving forward. So one of the main things that we do is support the autism community throughout Pennsylvania. So yes, one of our main goals is supporting ODP and the work that they do, but ASSERT is also larger than that. We've been tasked with supporting the entire autism community across the entire state. So while the programs out of the Bureau of Supports for Autism and Special Populations primarily focus on adults, we are tasked with the entire lifespan, with children, with supporting individuals who are young, families who have just had a child diagnosed with autism, all the way across the lifespan. Not only are we supporting individuals who are receiving supports through ODP programs, but we also create resources and we do things to support individuals with autism across the state who aren't in formal programs, who aren't receiving formal services. So the work that we do, yes, very much supports the Office of Developmental Programs, but we do support the broader community throughout Pennsylvania. A large portion or a large way in which we do that is focusing on education. And our education is, again, individuals with families. We create resources for individuals on the spectrum, for self-advocates, for their families, for support professionals, whether that be, direct support staff in the waiver programs, medical doctors, how to better support individuals that, patients of theirs with these diagnoses. I'll talk a little bit about the justice work that is done, general community members. So our goal is really focusing on information, resources, training for everyone, right? Because autism impacts so many people across the state, and most of us, of course, if we're here at the National Autism Conference, there's a reason we know individuals on the spectrum, but our goal is also to support the community members out there who don't have those formal connections. We also do a lot of work around measuring, looking at data. So Stacy mentioned, and I'll get into it a little bit more, some of the data projects that ASSERT has done over the years. We look at the numbers of individuals across the state with an autism diagnosis, trying to get a sense of who is out there, who has this diagnosis across the state. Along with that, we also look at what are their needs. So I'll talk a little bit about the needs assessment that is done. So measuring the needs of the autism community across the state. And we look at how those needs have changed, how the data supporting these individuals has changed. And we look at all of that, and that information is used in a variety of different ways. We'll talk a little bit about that in a few minutes. We also build. So we build resources. We have websites that I'll talk about with all of our resources and information that are out there. We build programs. Stacy had mentioned the psych rehab program is one that was developed. So taking the traditional psych rehab model and adapting that specifically for individuals on the spectrum. There's peer support programs that have been developed over the years. There have been programs. Actually, it was one of the things that I did when I first started with ASSERT, was to work on and develop a program to help individuals, teens and young adults, transition-aged individuals, with the transition to adulthood, and how to make that a smoother process. We've built programs or done work around social skills over the years as well. So that's part of the work that ASSERT does. And then, of course, kind of bringing all of these things together. So connecting people across the state, connecting people with local, regional, statewide resources, and sometimes even beyond that. So that is kind of ASSERT in a nutshell. We do a lot for a lot of different people, and hopefully we do it well. And so I'll get into a little bit more of the specifics of some of these things and how we actually accomplish these different areas. So just a little bit more. So our goal, our role, and our purpose of what we do is to bring together, again, those local, regional, and statewide resources in one place as best we can, and share those information and share that out with people across the state. Our goal is to also support, not necessarily replace, but support existing community efforts and activities. So there are a ton of great support groups that are out there. There's a lot of other organizations who are doing great work. So not only are we collaborative in the sense that we collaborate amongst the 3 regions within ASSERT, but we collaborate with a lot of other organizations across the state. We do work with SAU1, so supports Self-Advocates United as one, a very important self-advocacy group. We work with them and collaborate with them on resources and projects. PA Family Network, of course, we're working with ODP. So our goal is to, as much as what we can, support and collaborate with those organizations so that we can create resources and that people are better supported, and help maybe, connect with other resources. Because we are statewide, it kind of gives us that ability to be able to connect different people in different areas of the state, so that they can continue to grow and support the autism community. And then, of course, we do develop new projects, new resources, new trainings, we use that data that I had mentioned and talked about to kind of see where there are needs, see where there's gaps. And then we look and we see how we can potentially fill those gaps or help to bridge some of those gaps that are out there. All right, so some of the important things that we do or that we have available to get some of this information out is, of course, the ASSERT website. So this is just a screenshot of our homepage for the ASSERT website, which is www.paautism.org. So as you can see, there's a lot of different things going on our website. I'll get into a little bit, some of these a little bit areas in here. We do have general information about us, who we are, and the work we do. The Autism in Pennsylvania tab gets into the census and the needs assessment data, which again, I'll talk about in a little bit. You can create an account on our website. It's a free account. Creating a free account allows you to save resources. I think the last time I checked, we had over 1,000 resources on our website, not all ours. We don't just promote our stuff, we promote other great resources and websites and information that is out there that's going to help individuals and families. But with all of those resources that are out there, it can get a bit overwhelming on our website. So if you create a free account, you can kind of favorite them and save them. So that's what the favorite tab is. When you sign in next time, instead of having to search for that resource again, you can just go to your favorites and find them there. The resources are exactly that. It's all of the resources that either we've created or that we found out there that we feel are going to be helpful for individuals and families. The events tab highlights different events that happen across the state. So there's a wide range of things that we put on our events page. They can be, trainings for professionals. They might be more geared towards individuals and self-advocates. It might be, gatherings, social events that are going on, and it's for all of the audiences. So just like we said before, all of those different stakeholder groups, we have events for self-advocates, for families, for professionals, for general community members to learn more. So we have a pretty robust event calendar that we maintain. We also have our support group map. So this is a map that lists all of the support groups, all of the autism support groups that we are aware of across the state. We are in the process of updating it currently. Clearly with COVID and a lot of changes going on, there have been some changes to support groups. So it's always kind of a work in progress. I always kind of like to put that out there just in case, you would look at your county and find a group and contact them. They might not be in existence anymore. We try and keep up with it. I believe once or twice a year, we go through all of the different support groups that we have to try and update those and make sure that they're up to date as much as possible. And of course, we're always looking, if you know of one that popped up and has just started recently, or if you're like, this one isn't in existence, please let us know. As I said, we try and keep it up to date as much as possible, but it's kind of a revolving door sometimes with that. And then we do have e-learnings. So we offer free e-learning courses. We probably have about 20 courses, I think, up on our website right now. We just launched our new e-learning platform. So with that being launched, we are developing new courses, more courses to get up there. So that will be expanding and growing. Again, our e-learnings, our online courses are geared for all of those stakeholder groups. So self-advocates, family members, caregivers, professionals. We have a wide range of information and resources that we have out there that we maintain. So that is the main website that we maintain. We also have Aiden PA. So this is a unique website. This actually came out of COVID-19 last year. So COVID hit and, the world kind of stopped for a moment, and then everybody started scrambling to try and get information as much as what we could. And Aiden PA is kind of what came out of that. So talking about collaborations and what we do, Aiden PA is a collaboration that was developed between the HICUs that Angela was talking about before, so the healthcare quality units, and ASSERT. So we partnered together to create videos. I think we were putting out about 3 new videos a week related to COVID, again, for different stakeholder groups, on how to kind of manage, just information that we were finding out as we went, ways to help individuals manage with all of the changes as a result of COVID. So we had a really robust library of resources that we had created in all of these videos for self-advocates and families and professionals. And so we put them together in the AID and PA website. What we realized, though, is that this was a really great collaboration, and there's a really, wide range of information that we have now at our fingertips. So we kind of created this website, and it's been in existence for a little over a year now. So you can find COVID resources on here, but you can also find other resources. So again, going with that collaborative nature, we've been working with, ASSERT has been working with ODP on developing resources around emergency preparedness. So we have some of those resources that are going to be on AID and PA. And the thing about AID and PA is, while ASSERT is primarily focused on the autism population, AID and PA is a bit of a broader audience. So it's autism and intellectual disabilities. So that's where the AID came from. So autism and intellectual disabilities in Pennsylvania. So these resources are for a bit of a broader audience, but we have things about emergency preparedness on there. We have information about human trafficking, which kind of came out of emergency preparedness on there. We have additional resources. We've done a collaboration with the HICUs and Temple around healthy sexuality, healthy relationships. Those sorts of resources are going to be on there. So this is going to be a place that's going to continue to kind of grow and highlight some of those projects and resources that we are doing with some of the other agencies across the state in that collaborative fashion. So that is another resource that's out there for individuals to access. Our third website that we oversee at ASSERT is ASD Next. And this one is specifically geared towards teens and young adults. So when ASD Next was launched, the goal is really to help and support self-advocates. What we found out was there's a lot of parents and professionals who access the main ASSERT website, which is fantastic, and we love that. But we were getting feedback that there's a lot of self-advocates out there who they were looking for information and they didn't quite feel like the main ASSERT website was meeting their needs. So we created ASD Next. So this is specifically geared towards self-advocates in mind, and it's very similar. So there's resources, you can find resources here about a couple of different areas, and we focus more on things that are going to be impactful for self-advocates, but very similar with the resources that are available. We also maintain a social calendar on this website. So the social calendar is more geared towards, I don't want to say there's no professional or training events on there. There are, again, as they relate to teens and young adults and self-advocates, but it's more socially focused. So what we did when we were doing our focus group for this, we were hearing, from a lot of young adults and on the spectrum. They wanted to be involved, they wanted to be out, they wanted to be social, but they didn't know where to go to kind of find different things in their communities. So that's where the social calendar came out of. So and the other thing that we heard was, I don't necessarily want it to be autism focused. So I don't need it to be a special needs event. I just want to know what I can go out and do, and I don't know where to find that information. So our social calendar is actually maintained by a self-advocate who works for us. They look online, they find resources across the state and events that are going on and put them up on the social calendar, just as a way to kind of give some different ideas for things to do and get involved in communities across the state. That individual who maintains our social calendar is actually also a blogger for us. So that's another feature that we have as part of the ASD Next website. We have, I believe right now we are up to 7 bloggers who write for us. All of these individuals are on the spectrum. They live across the state. We try and get a pretty wide range of opinions, geographic areas. We want to try and represent the state as much as possible. And they just write about their experiences, what's going on in their lives. I know one of our bloggers, Kyleel, just wrote about getting his driver's license and what that experience was like and the process of going through that. So a lot of times they write about just things that are going on in their life, how they've managed different situations that might, help other self-advocates who are out there. to learn from their experiences. Sometimes we ask them to write about specific topics depending on what's going on. Some of them have shared their experiences with COVID and things like that. So it varies what they write about, but that's another great feature that we have. And then another thing that we're starting to work on right now is a community page. And the goal of that community page is, again, to bring people together and to connect. So that was another thing that we had heard, a safe place for individuals to connect with others on the spectrum that was safe, that they didn't maybe have to worry about online bullying, trolls, some of the things that, everybody kind of has to worry about with social media and being out there in the social online cyber world. So that is something that we're actually getting ready to launch and put together, and hopefully kind of create a page where individuals on the spectrum can come together and connect and just interact with each other in a safe space. So that is another website that we have full of great information and resources that hopefully you'll check out and access. So we also run a statewide resource center, and I believe Stacy mentioned this earlier in her introductory part. So this was created, this is one of the things that ASSERT started way back from the very, very beginning. And the purpose of it is, there's multiple purposes for this. Sometimes we are just an ear, someone to talk to, someone to listen. Sometimes it's those families who are calling because their child was just diagnosed. They're overwhelmed. They don't know what to do. And they just kind of need someone to listen, not necessarily therapy or counseling or anything along those lines, but just a supportive person to listen and talk to them. And then, yes, maybe help provide some information and resources that would be helpful to them with whatever they're experiencing or what's going on in their lives. Our resource center is open to, again, anyone across the state, anyone in any, different stakeholder group. We have community members call. One time we had somebody who was interested in starting essentially a special needs flag football. And he had no experience with special needs, just thought, hey, maybe this would be a great idea. Called and said, what do I need to know and how do I get this started? It's parents that call in, it's professionals. We do get supports coordinators who call us sometimes asking questions or looking for information. So really it's anyone can call in and ask questions. Sometimes they are asking for a very specific question or they're looking for a very specific resource need. Usually when I'm doing these talks and presentations, I say, if you're looking on our website and you're really kind of struggling to find something or you're not sure, we do have a lot out there. Just call us, just call the resource center and say, hey, I'm looking for a resource about employment, or I know that there's this specific one out there and I can't find it. Can you help me out? We're there for that too, to kind of point you in that right direction and give you those specific resources and answer those specific questions. And sometimes it's just an unspecified need. They don't really know what they need. We do see that a lot with teens and young adults. We'll have parents calling, my son is getting ready to graduate high school and we don't know what we're supposed to be doing. What do we do? So we do get that sometimes. So really, we're just there to kind of support, again, statewide, across the spectrum, across the lifespan, as best as what we can. You can access the resource center and the phone numbers for these are at the end as well. There's a contact form on our website. So if you go to paautism.org, you can contact us through the contact form and that'll get to us. You can email us at info@paautism.org. And we do have an 800 number that you can also call. We also have a Spanish line. So we have a specific line for individuals who are Spanish speaking, that we have a resource center specialist who is Spanish speaking who can help with that. So both the email and the 800 number have Spanish versions of them. Oh, there we go. I got a little bit ahead of myself. So we do have the English and Spanish. We call it a warm line. It is not a call center in the sense of you call and you get a person. You do leave a message and we will get back to you. I believe our standard is within 2 days that we try and return phone calls or emails. The reason that we do that and we don't have a dedicated, answering, call line at this point in time is because we do like to handle things regionally. So that is one of the things that we do, even though we're collaborative, we do break things up across the regions because we recognize that there may be specific things, in central region that are different from out in the western part of the state, or there's programs or things available here that maybe aren't, in the Erie area. So we do that a little bit regionally. So our resource center specialists can really know about what's going on in their area and specialize kind of in that way. So we do have the English and Spanish warm line. You can also reach us through social media. ASSERT is on Facebook and Twitter. We do have people who reach out to us through, Messenger and ask questions that way. We'll respond and get you resources that way as well. And of course, the email, like I said, is available in English and Spanish. All right, so getting a little bit more into some of the resources and things that we have available on our website. As Stacy mentioned, and I mentioned as well, that data portion of what we do. So one of the big things that we've done over the years is the PA Autism Census. So this was done twice, that ASSERT has looked at and tried to get a sense of how many individuals with autism are living in the state of Pennsylvania. So the first one was done in 2005. And then there was a follow-up one that was done in 2011. So if you go to the ASSERT website and you go to the About Us section, you can find more information. What you can find is these maps and these reports. So on the left, you see a map of each county. You can click on the county, and what pops up then is kind of what you see on the right. So it's just a sample report of the Dauphin County Autism Census. You can see, ethnic and racial and ethnic distribution for that specific county, the ages of the individuals for that county. And you can get into some pretty in-depth information county by county across the state for the census. And if there was any reason why you would want a very specific census report or specific numbers that were, that you would want for your county or area, reach out to ASSERT and we can run separate and very specific reports on the data for you. So those are one of the things that we kind of look at. A second thing that comes out of that with that data is the PA Autism Needs Assessment. So again, this was done 2 different times. The first one was done in 2011. This is a screenshot of the dashboard for the most recent needs assessment that was done in 2018. So you can go again and look at very specific reports. The website for this is needs.paautism.org. So when you go to the website, you can see the surveys themselves. They were put out in multiple languages. You can read the reports and you can explore the data. And the data is broken down across the life course tools, so the life course domains. So you can go into each of these separate areas of daily life and employment, community living, and you can look at the responses. And the survey was done of individuals, so self-advocates and their family members. So if individuals were able to self-report and answer the questions on their own, that's included in here. For individuals who maybe aren't able to answer the questions on their own, their families were asked questions, and all of that was compiled into all of these different reports. And again, very similarly, if you're looking through the data and the information and the different dashboards, we can run specific reports if you're interested in different areas, but a lot of information about the needs. And as I said earlier, we take this information and we see where there's gaps in services. What are families and individuals saying that they need, or that there's areas of need? And that information is also shared with ODP, and they use that for programming and for a lot of different reasons. Talked a little bit about our training and the fact that, training is an integral part of what ASSERT does. So we also just kind of, if you're ever curious, we do have a training map on there. So it shows beginning, I don't remember the year that it begins. It's been a while. So you can look by year or you can look overall. So this is just, again, a screenshot of our interactive training map. You can look by county of how many trainings we've done, how many people we have trained, the types of trainings, like the titles and things like that, the different areas that we cover. So that's just kind of an interesting thing to keep up and show how many people we're reaching with specific trainings that we're doing and that we offer. All right, so getting into the resources a little bit more. I'm starting off here with really what our whole talk was about today. So we do have waiver resources on our website. And as you can see, most of these have dedicated web addresses to make them easier to find. So if you're looking for the waiver resources on our website, all you have to type is paautism.org/waiver. And what you will find is all of the resources that we developed in collaboration with ODP. And it really goes through all of the stuff that we talked about today. It's nice. It's all on the website. You can also download all of these resources. So there's PDF downloads of all of these things. It goes through all of the different waivers that are available to individuals, the services that are associated with each of those waivers, how to apply for those services. Again, so most of the stuff of what we talked about, of what Stacy and Angela went over today, you can find here on this website, and you can download those resources. You can also find the information about how to register with your county, what you need to do to register for your county. We have a checklist that people can kind of print off. So if you're going to register with your county, it'll go through all of the paperwork that you need in order to go and do that. And it also goes over that functional eligibility criteria, which can sometimes be confusing. So we have a resource that really kind of gets into that, what it is, what those, the Vineland and the ABAS, as they were talking about earlier, the importance of those, how to get those, where you get those results from, and all of those sorts of things. So it's a really great and helpful website page on our website, all about the waivers. This is another resource that kind of goes along with that. So we have a clickable map on our website where you can find you can find some of the main county government offices by county. So again, this is a clickable map. You can click on your county, and what pops up is things like your local Social Security office, your county assistance office, the OVR offices for your county. You can also find the intermediate units, the county MHIDEI offices for your county, and information for crisis intervention. So again, sometimes not easy to find. We did put it all together on our website where you can kind of find all of that in one place by just clicking on your county. All right, so branching out into just kind of other resources that we've created over the years that we felt might be helpful for you guys to know about is, of course, COVID-19. While we're hopefully coming out the other side of the pandemic, there is still a lot that we're dealing with. So last year, when COVID hit, we really started focusing on developing a lot of resources around COVID-19 and how to support individuals and families with the massive changes that everyone was going through at that time. So we do have information specific to COVID. We've developed a lot of social stories. What is COVID? Social distancing, social stories. We've created social stories about online e-learning and how to manage those sorts of things, wearing a mask. I think even today, our wearing a mask social story is probably our most used and referenced and top resource at this point in time on the website still, of our social story around wearing a mask. So we have a lot of resources about that. We have resources about the vaccine. Again, social stories about getting the vaccine, what to expect when you get the vaccine, just kind of general information about that. And then additional resources that kind of go along with COVID and how do you manage changes with it and schedule changes and all of those different things. And actually right now, you can either use the link that is listed here on the page, or when you go to the ASSERT website at the top, there's actually just a header where it says COVID-19 resources, and it'll take you directly to the dedicated page for this, where we have all of our information about COVID. Another big project that we have worked on for years and really continues today, more so than ever, is our justice resource collection. So it's been going on for a couple of years at this point in time. We do a lot of trainings for justice professionals. Again, you can find a map, an interactive map on this page as well, about who we've trained, where we've trained justice professionals across the state. This ranges from magisterial judges to statewide judges. We did a a 4-hour, I think, training along with ODP staff last year at a statewide judges conference right before COVID hit, doing trainings for police officers, for first responders. So not only do we have resources and information for professionals in the justice system, but we also have a lot of resources for individuals and families. So what to expect if you have to go to court. We have social stories about the foster care system. We have videos showing what to do if you get pulled over, if you have to go through a pat down, kind of explaining all of these different processes and what to expect and what to know. So this is a really robust resource collection that we have, and continuing to develop new resources as we collaborate with more justice organizations across the state, and again, continuing to fill the gaps of where both sides kind of need to learn more, how to interact with the justice system, and for justice professionals, how to better support individuals with autism who may come into the justice system. We have a transition toolkit. So as you can see, this is across the lifespan. So when we talk about transition, I know personally, when I hear transition, what I first think of is the transition to adulthood, because when we're talking about autism, that was always like the big transition, right? Very supported in school and all the way up through, but that transition to adulthood we knew is a difficult one. However, we also recognize that looking at the lifespan, there's a lot of transitions across the lifespan. So this website provides transition resources for all of those different life transitions. So for families who are newly diagnosed, here's some of that basic information that would be super helpful. What do you do first? Who do you get connected with? Where do you go for all of those sorts of things? Then we kind of have the early intervention, preschool ages, resources for them. The transition to elementary school, transition to kindergarten is a big transition for some individuals. How to prepare your child for that transition. 5 to 11 is the elementary school years, so we focus on things like that. 11 to 21, middle school to high school, getting into those college years. So we have resources about transitioning to middle school, changes in what to expect. We have transitioning to high school. We have resources that focus on physical health that you need to be aware of. How do you focus on that? How do you prepare for transitioning from a pediatrician to a general practitioner, not going to a pediatrician anymore, the doctor you've seen your entire life. So things to think about and consider there. And again, adulthood and older adults and across the entire lifespan. So this page on our resource is really a collection of a lot of different resources kind of grouped together based on life transition periods. We also have resources for support professionals, focused on a lot of different things. So these really are, if you're supporting individuals on the spectrum, ways to support their mental health, how social stories can be used. These are groups of infographics and prezzies, so short presentations that are kind of self-paced that you can go through. How to support people who might be in a crisis situation. How do you develop relationships, build rapport with them? So really just these are all geared towards direct support staff and support professionals on how they can better interact with and support individuals on the spectrum. Our Be Safe resources, we started developing a couple of years ago. These really came out of the data that came out of the Justice Department. There's the NPR story looking at the rates of sexual abuse and assault in individuals with intellectual disabilities. So the data is really not great. The data that came out of the Justice Department still really isn't that great, but what we did find out was, at the very least, individuals with intellectual disabilities are sexually abused and assaulted at a rate 7 times that of the general population. So it's clearly an issue, and we recognize that. And at the time, Nancy Thaler, in charge of ODP at the time, really recognized that and kind of came and said, what are we doing about this? We need to address this. So what are we doing? So ASSERT, we partnered with the National Crime Victims Treatment and Research Center at the Medical University of South Carolina, because that's what they do, trauma and victimization and kind of abuse topics, and they were really the experts in that. And we partnered with them to kind of layer in the autism and intellectual disability piece and bring those together, and really created, there's a lot of information in these resources, focused on prevention. So how do you prevent someone from experiencing or reduce their chances of being victimized when it comes to sexual abuse and assault, and also intervention. So if you've now, if somebody unfortunately has experienced sexual abuse or assault, how do you support them? What are things that you need to know? What do you need to, to best support them in their daily lives? So we go from both sides of it. And again, all of these resources are for a broad audience. We have resources for individuals, for parents and caregivers, for professional staff, even therapists and physicians. And so we really kind of tried to hit as much as what we could. So you can find those at paautism.org/be-safe. We also have more recently developed resources around mental health. So Be Well, Think Well are mental health resources that we've developed over the past 2 years at this point in time. And again, this is kind of tied in with some of the work with the justice system and the justice professionals, and that unfortunately sometimes why individuals on the spectrum have interactions with justice professionals are more related to mental health concerns than what they are anything else. So really, again, we kind of took this from both sides. So we have resources for self-advocates, individuals on the spectrum. We also have resources that we developed around mental health and emergency situations. We have resources for, professionals, for emergency personnel. If they're coming across an individual who is in crisis, what do they need to know? How can they best support that individual in that situation? So we have things around general mental health, how to access services, how to get connected, how to prepare for, if you see a psychiatrist, medication appointments, what you need to know going into those. We do focus on topics around anxiety, depression, bipolar disorder, psychotic disorders. And we do have resources, again, around suicide and for emergency situations. So it's pretty robust. We're kind of finalizing a lot of these resources. COVID kind of derailed this for a little bit, so we're back onto it. We're in the process right now of kind of finalizing some online trainings. So our e-learnings that we offer, we're turning this content into e-learning trainings that people can sit and see and watch and learn about these topics that way as well. All right. We also have information about Act 62, so the Autism Insurance Act. It tells what it is, general information for families so that they're better aware of what it is, the difference between private insurance and Medicaid, why this is important to them, how it impacts them, what you can do or what families can do if they've been denied services, how to go about appealing that. All of these resources cover all of those topics around Act 62. We also have a physical health resource bundle. So this just covers some of the main health concerns that are common for individuals with autism. So sleep issues, seizure disorders, GI issues, we know all of those are concerns for individuals. So it goes over all of those different topics, provides information and resources. It also covers obesity, as that is an issue for individuals on the spectrum as well. So again, just some general health and related issues. We're also working to increase some of the content around these resources in the Western region. They've actually partnered and are collaborating with some physicians out there to create new resources around eye doctor appointments and blood draws and, MRIs. So really creating social stories and content to kind of help people with those really important procedures that sometimes individuals on the spectrum struggle with. Talking about HICUs, bringing those up again. We actually had the HICUs reach out to us. There was somebody that they were supporting who was really struggling with getting a colonoscopy completed, had some concerns, really needed to get it completed. They had tried 3 different times, gone through the prep, was never able to go through with the procedure. Asked if we could help create a social story we created a series of 3 social stories around colonoscopies, what they are, the prep for a colonoscopy, and what to expect when you go. And collaborated with the HICUs on that, handed them off, and they reported back to us that using those social stories, the individual was actually able to finally follow through with and get their colonoscopy completed. So we're looking to kind of do more of those sorts of things. So this bundle will be expanded. We're actually right now also, I think it was another HICU that reached out to us about a resource, a social story around pelvic exams for females. So that's one that we're working on right now. So these resources are going to continue to be expanded, something that we're actively working on right now. Our LGBTQI resource page. This page has a lot of resources. We actually have another self-advocate who works for us in Central Region, who is part of the LGBTQI community, who collaborated with us to develop resources. Again, their resources are really focused more on individuals on the spectrum so that they can learn more about gender and sexuality and identity. So we have those up there. We are also in the middle of collaborating with SAU1, so Self-Advocates United as One, on turning this information into online courses, kind of I believe they're calling it like LGBTQI 101. So we're in the process of doing that. Again, they have some self-advocates who work for them, who are part of this community and are working on this content. So this is something that is going to be coming out this summer, some of those courses and additional information that are out there. We do have a voting resource page. I know it's the middle of summer, not really looking for, voting stuff right now, but elections are always coming up in the fall. So we do have resources about voting, the voting process, the importance of voting, preparing to vote, what you can do to identify, if an individual has a disability, if they have needs when it comes to voting, accommodations, you can find your polling places, all of those sorts of things we have on our voting resource page. We also have an employment resource collection, which goes over social skills related to employment, geared towards, of course, individuals on the spectrum, things to pay attention to. We have things about interviewing process, relationships at work, all of those sorts of things. We have information about OVR, what they can do, how to connect with them, the different services they offer, how to create resumes, bank accounts, finances, credit cards, all of those sorts of things kind of come with jobs and finances and money. And again, applying for jobs and interviewing. So we have resources around all of those topics related to employment. And then we do have social story resource collection. We have a lot of different social stories that we have developed over the years in different partnerships with different organizations. So you can find those on this page. You can also find information about how to make your own social stories. We have some templates that are on there. We have information about that, of how to go about doing those sorts of things. Some other great social stories from other organizations, and social stories for adults. Again, not just for children, but social stories are a really great way to, share information, not just to individuals on the spectrum, but really, a wide range of learners and neurodiverse populations can really benefit from social stories. So we do have a lot of those and kind of information about how to create those on your own, if maybe there's something that you need that we haven't developed yet. All right, so that was a very, very quick overview of ASSERT, some of our resource bundles that we have out there. As you can see, this lists our website, the phone number, so 877-231-4244 is our our resource center if you call and ask for any questions, or you can reach us through info@paautism.org. We'd like to thank everyone for joining us today to learn more about County Connections and post-school supports. We hope that you've learned a little more about the Office of Developmental Programs and the Bureau of Supports for Autism and Special Populations, in particular, administrative entities, supports coordination, and services available to individuals with autism across the state. Additionally, we hope that you will leave here with access to new and helpful resources that will help you moving forward. If you have any additional questions, comments, or feedback on this presentation, please feel free to reach out to Stacy, Angela, or myself. Thanks again for joining us today.